ദൈവനാമത്തിൽ എല്ലാവർക്കും വന്ദനം ചെയ്യുന്നു. This session is particularly for those who understand English only. I'm going to talk about hemorrhoids. In India, it is called piles also, but in European countries, the disease condition is called hemorrhoids. And 50 to 60% of people in America have some degree of hemorrhoids, and that is so widespread because maybe it is because of the food habits they may be having. That is the non-roughage food. They are having this junk foods they take, and reduced amount of water during the daytime. And another reason of developing hemorrhoids is inadequate chewing. Inadequate chewing leads to inadequate digestion of food, and it leads to difficulty in passing the roughage in the colon. And we should drink adequate amount of water, otherwise this hemorrhoids will be affected, and hemorrhoids will be increased in size and degree. And also roughage, I have already told, we should take roughage, whole grain food in diet. Lack of whole grain food in diet is one of the reason for hemorrhoids. And another reason is a prolonged standing. The gravity effect of the blood and the flesh which drives which acts downwards leads to development of hemorrhoids. And the last reason is genetic factors. In families, this hemorrhoids are found in families. And these hemorrhoids may be internal or external. Internal hemorrhoids or external hemorrhoids. Internal hemorrhoids cannot be seen outside, and external hemorrhoids can be seen outside. This signs and symptoms, signs of hemorrhoid or piles is anal pain, difficulty in defecation, and clots coming out of the rectum, and bleeding, and also protrusion of piles outside. Treatment, there are many good modalities of treatments for hemorrhoids. One good treatment which has recently have come to me is a tablet called Retiver. A Retiver tablet, if you taken 1 to 2 months, will cure hemorrhoids. And I've seen good effect with Retiver. And this chemical name is calcium dobisulate 500 milligram, which should be taken morning and evening for 1 month to 2 months, and maybe extended to 3 months. Other treatment is good exercise. to the body. Yoga exercises will reduce piles. That is a well documented finding. The good yogis don't have piles or hemorrhoids, and we should drink adequate amount of fluids, and we should masticate the food well. And the pure surgery aims at removal of piles, and most of the people resort to surgery because of the easiness of undergoing and the quickness of treatment, etc. And the treatments are one, excision of the piles. The piles will be removed by excision. Second is banding of the piles. That is, a rubber band is put across, on the piles swelling, and left alone for 4 or 5 days, and it comes off by itself. And 3 is laser treatment, which is very popular now. And 4 is dilatation, manual dilatation of the region because of the tightness of the region. And I have used other treatments also. The simple home remedies also I prescribe to patients when they come with hemorrhoids. One is olive oil. Olive oil daily. Take olive oil daily. 5 ml of extra virgin olive oil. 5 ml daily for 10 days. It will cure the hemorrhoids. If it is mild cases or moderate cases, it will be effective. And second is apple cider vinegar. Dilute it on a cotton and apply it on the piles, and it will. If it is concentrated, it may burn. So be careful. So it can be applied, and it will the size of the piles will be diminished. And third, another effective treatment is lemon juice, application of the lemon juice. And fourth one is aloe vera ointment of aloe vera, which will soothe the hemorrhoids and piles. And another one is the most important thing is the intake of whole grain in the diet. All grains should be taken whole in the diet, and the processed food should be reduced to the minimum. Thank you.